A little over 8 years ago, my mom decided to move out to Arizona, be closer to her sister and get out of the cold weather. She moved into an independent living, enjoyed it, loved it out there. Then I get a call from the facility that she had fallen. She wasn't hurt, she had just fallen in her apartment. 2 weeks later, she fell again in her apartment. And about 2 or 3 weeks after that, she decided to go to the post office late in the afternoon and was driving over there, gets out of the car. She said, I just felt dizzy. I just passed out like I was going to sleep. She fell down into a ravine with big old boulders about this big around, fractured a hip or leg. Ended up at the hospital, of course, with surgery and then having to go into skilled nursing care for rehab for a month. And at that point, she was unable to go back to her home. So we decided as a family to move her back to Missouri. Moved her back and admitted her to an assisted living. And a few months ago, I was over having supper with her. And about 5:30, I'm looking at Mom, and just all of a sudden her head drops, her arms drop off the table, and her head hits her chest. And I called the nurse over, and they check, and her pulse had gone down, vitals. I thought I'd lost her. Thought she was having a major cardiac event. So EMT came, took her to the hospital. Time they got there, she was coming back around. They couldn't find anything wrong with her heart, so they ended up, after 24 hours, put a heart monitor on her for 30 days. Nothing ever showed up, heart functioning fine. Then I get a call a few weeks after that, same time around 5:30, that Mom had passed out, fell into her food again, and they took her to ER. Couldn't find anything wrong again. So I was over there about a month later having supper with her, and at 5 o'clock they gave her one of her medications. 5:30, same thing happened again. Totally went down, vitals were gone. Come find out, this drug that she's been taking for years, as she gets older, things change. And the one little drug can cause what's called a sudden sleep disorder. Had nothing to do with her heart, but because of that one drug, it caused hospitalization, fractures, ER visits, decrease in quality of life, having to move back from Arizona. Drugs should enable patients, and my mom, not disable her.